Hey gang, how we doing? Happy abnormal people! So here is the long-awaited interview I did with Chad, Dr. Larry, and obviously myself. I want to give just a little bit of a preview on this. Number one, when I shot this video, the original audience was I was talking to a group of businessmen. And so I refer to a few things in here that may not make sense to you because I specifically say things about your business. I specifically say things towards men. But after I got done the interview, this is relevant news for anybody. Business owner, male, female, doesn't matter. But I wanted you to know that in there's going to be 2 or 3 or 4 times where I specifically talk to men and talk to business owners. So just know up front that's what's going on in some of this video. It's about 14 minutes long or so, and watch it to the end. There's some really valuable information, I think, from even Chad at the very end that I think is worth staying and watching the whole thing. So watch this video. If you feel like you need to take steps after you hear what Chad has to say and what Dr. Larry has to say, go see your doctor. Go see your doctor and get your numbers done. You guys are awesome. Be abnormal. Go take care of yourself. Bye. Enjoy. Hey guys, how we doing? So you know me, I'm Bruce, and today what we're going to do is we're going to do a really short video, but this video actually may save your life. As you know, I own a brick and mortar gym, and within that, Chad here was one of my clients, and we're going to get into why this is such a great talk. Chad, super fit, but we're going to find out that that's not everything. This guy right here, Dr. Larry Weathers. And so what we're going to talk about today is within everything I do with you guys, you got to know your numbers, right? I talk about you have to know what your waistline is, you have to know what your blood pressure is, but today we're going to talk about something that's called calcium score and why that's important for you. And Dr. Larry's going to go into details about that, but to get started, Chad is going to tell his story to you. How old are you, Chad?
I'm 51.
So Chad's 51. Chad worked out with me for about 2 years. High-end workouts, guys. I'm talking heavy circuits, always kind of, I wouldn't say redlining, but heart rate's way up. How would you describe the workouts overall?
Tough. Definitely wear you out.
So, got super strong, all those kind of fun things. Never had short of breath, never, well, you tell them. Have you ever?
Sure. No, never had any symptoms myself. I completed the workouts, and yeah, I was tired, but certainly never felt the any of those classic symptoms, I guess you could say, were attributed to any kind of heart or issues.
So like no chest pain, no faintness, all those kinds of things. And so one day he walks into the gym, he's like, I think I have to have heart surgery. I'm like, what are you talking about? Heart surgery. So tell these guys the whole, like, kind of your story with that.
Yeah, sure. So I'm real fortunate. He just recently retired, a great primary physician by the name of David Garrett here locally, who I have had high cholesterol for probably 10 years or so. And really tried to control it with diet. Really did not want to do the medication for the longest time. My physician kept after me, and I'd get it down to low 200s, and then next appointment maybe it'd be back up to 240. And so finally put me on medication. After a couple of years of that, Dr. Garrett suggested that I have a calcium scoring test at the local hospital. We're fortunate here because of Mercy Hospital. It's a $50 test. It's very inexpensive, and he's like, I don't know why we wouldn't do it. And really, all it's going to do is look for those buildups or deposits of calcium within the arteries. And so I went and did one and got my calcium score, and it was 160 or 165. I can't remember exactly. And when I visited with Dr. Garrett, he was saying that look, it's not great. That means there's definitely some calcium deposits there. Maybe it's not alarming yet, but we'll probably repeat it next year. So kept taking my cholesterol medication for that same year. Was exercising with Bruce, doing really well. Being reasonable on my diet, and did it again the following year. And my cholesterol, or my C-score, my calcium scoring test, had gone up to 265 within the year. And so then my primary physician, Dr. Garrett, essentially said, look, this is a problem. If we've gone up this much in this short amount of time, have you changed your diet? Have you stopped exercising? No, I'm pretty much all the same. The one thing that changed that for me was stress, and so that really showed me right then and there how much maybe stress, played a part in that. And so we took the next steps of doing the, the stress test. Getting on a treadmill. Was able to do that without a problem. I think I wore my dress clothes. I didn't even really have to break much of a sweat because of what I'm able to do here. But again, my physician pushed me to go the next step and go in to see what I could do as far as I'm going to forget the name of the procedure, Dr. Weathers, where you actually either go in through the groin or through the
we call it cardiac catheterization, cardiac cath.
Cardiac cath.
Or coronary angiogram is the technical name.
Okay. And so I went and did that procedure, and when that procedure found that my widowmaker artery, or the LAD, the left anterior descending, was 80% blocked. And unbelievable to me that could happen and not feel any effects. I think that's the scary thing for me that really scared me and made me realize how close I'd come. But I had 2 stents placed in that, and I've, honestly, I feel the same. So there's not an improvement in me, but what I've done, I've probably, or certainly extended my life and hopefully caught it early on. So understand that so much better now.
So you already said 80% blocked and didn't have anything going on. So if we didn't have the test done, he wouldn't know, right? So you got to know your numbers. So Dr. Larry, tell them what a calcium score is and how they could go about getting that score done.
Well, I think the best way to think about a calcium buildup in the coronary artery, if you can image a small, tiny volcano, what happens over time is that these tiny volcanoes in the lining of a blood vessel that's no bigger than a straw, they rupture, and they erupt like a little tiny volcano. And then the body thinks there's a cut, and so it forms a clot. And so if you have had a bunch of plaques that have ruptured before, and you have laid down like rings of a tree plaque in the lining of the blood vessel, that clot may be big enough to totally occlude your coronary artery, which is called a heart attack. And so the problem in the United States is that we have a couple of million heart attacks a year, and these heart attacks, many of them were unassociated with any symptoms like Chad had, right up until the time that it's diagnosed. Problem is the diagnosis of heart disease by either having a heart attack or having sudden cardiac death or dropping dead about 40 years ago became untenable for me to think about. So I thought, 50% of the people in this country get diagnosed by having a heart attack or having sudden cardiac death. That doesn't work.
Right.
And so I started looking for a test to diagnose atherosclerosis, which is what this disease is called, before patients could feel it. And the problem is you have to have a 70% narrowing or more before you even get short of breath. And because the heart can compensate really well by delivering more oxygen to the muscle, which is called the left ventricle, it can compensate really well up until about that point. So when a plaque ruptures, in the healing process of the plaque rupturing and healing, it lays down a little bone tissue in there. And so the only way you get a calcium deposit in a coronary artery is that a plaque ruptured and healed.
Okay.
So the concept is real simple. If you have anything other than 0 in your coronary artery calcium score, we call it the power of 0. If you have a 0 calcium score, then you've kind of got a 5-year warning, that your risk of having an event like a stroke, a heart attack, is pretty low. Once it gets above 100, then the risk goes up about tenfold. And once it goes up above 200, the risk goes on up. Once it gets above 300, then you've got a high risk of having a blockage of at least 50%, which you still can't feel. Okay? But at least we made the diagnosis of asymptomatic or atherosclerosis without any symptoms yet.
Right.
So we can put you on a blood thinner, like maybe aspirin, to prevent those clots from getting big when the plaques are rupturing. And because they're rupturing every day.
Okay.
So it keeps the clot from getting bigger. The statin therapy, the cholesterol lowering therapy, is a double whammy. Number one, it changes the consistency of these plaques. There's a little lipid lake in there inside a plaque, and it makes acid and eats a hole in the roof of the plaque.
Okay.
So you can kind of freeze that lake, like the movie I watched with my grandson called Frozen.
Oh yeah.
You can freeze that lake.
Yep.
Okay, and then those plaques are less likely to rupture. But the most important concept is this: if you even have a plaque of a calcium score of 1, okay, then your risk goes up. You know, what you want is to flunk this test cold.
Right.
You want to get a 0.
You want a 0.
You want a 0 on this test. So, you know, the sad thing about it is that the paradigm has shifted. The first test, I believe, in diagnosing asymptomatic coronary artery disease should be a calcium score, because then you either have evidence of coronary artery calcium or atherosclerosis, same thing, in my coronary arteries, or I don't. That's an important question to get answered.
What age?
That's controversial. I think that even in totally asymptomatic people, they should have a calcium score in men at 40 and in women at 50. Okay. The crazy thing that Jeff Carr did at Vanderbilt in a study called Cardia is that he tracked women from 30 to 50 for 15 years. And any calcium in a woman below the age of 50 increases their risk tenfold.
Really? Wow.
So, you know, now that throws a wrench in the thought process of whether or not we need to give women the equality that they want.
Yeah.
And,
Right.
and start doing the calcium score in women at 40. I don't know the answer to that.
And does it change if you have a family history? So in my case, I actually had my maternal grandfather had coronary artery disease. So
Well, that's a great point, because the algorithms that calculate risk, there's a bunch of them out there where you can plug in your cholesterol and all that sort of stuff. The lacking thing is just what you said. None of them include family history.
Interesting. And how important do you think family history is? From all your years of experience, what do you think?
Well, if you don't smoke, it's the number 1 risk factor.
okay.
Okay.
None of you smoke, right? Thank you.
And so, and then, you know, once you establish the fact that, and it's not so much of a problem in here with the people that come here, because they're already managing their lifestyle.
Yeah.
Okay.
They're moving.
They're doing their lifestyle management already. So most of the people that are here are fit, or at least trying to get fit.
Right.
And so what we're trying to do is making sure these fit people that are hard driving people are well. Okay?
Right.
So here's the deal, and this is what we talked about off camera, is Dr. Larry brings up a good point with Chad and I, because Chad and I, we look fit, but like he found out he wasn't well. And there's a big difference, right? So what he's trying to tell you is, if you don't know your numbers on the inside, because you know, last time I checked, you couldn't see your heart when you look in the mirror, you can just see your biceps. You may have big biceps, but what you don't know is your heart may be getting clogged up. So a test like this and others are going to help you understand the inside health of that heart. And so I wanted to share that story with you because of this guy. Love this guy, looked super fit, and come to find out his heart was just not there. So he needed a little help. And he wouldn't have known that unless he had a good doctor who pushed him to get numbers done. And so if you don't have a good doctor, that's number 1 thing. Go get a good doctor. And then talk to your doctor about what tests you may need. We're trying to just tell you that calcium score is one of those important numbers that you may not have heard of before, and you may not have had that discussion with your doctor before. And so I want to close with this. Number 1, is there anything else you guys want to add before we sign off?
Well, I'd just like to comment on, once you find out that your calcium score is 0, okay, there's still a tiny group of people, because the concept is this: if you have a calcium score of say 10, okay, then that's an iceberg, okay? That 10 represents about maybe 20% of the underlying plaque that you can't see.
Okay.
And so any plaque, any calcium should shove you into managing your risk factors. We can't pick our parents, and so we can't manage the family history. We can stop smoking. We can get our blood pressure down. We can control our diabetes. We can get our cholesterol down. And so by doing all the lifestyle things and treating your other bad numbers, you can reduce your risk of heart attack or stroke by about half.
Wow.
And taking a baby aspirin sounds simple, reduces your chance of fatal heart attack by about a fourth.
That's big.
And
Something very simple and very cheap.
Yeah, baby aspirin. Make a note.
I'd also add that the last piece of that for me is learning how to manage stress, and I think that's the big key for me is I learned how to do meditation, and through something as simple as an app on my phone, and really learned how much of a difference that made. Because for me, reducing stress is having to work out and getting some good cardiovascular exercise, but also when those times when you aren't working and you can take 5 minutes, 3 minutes, whatever the case may be at work, and be able to go and do a quick meditation, how much relief that gives me.
Absolutely.
And how much it means to the overall health. As you said, wellness is the key, not fitness is only half.
Yeah, I think we're just now touching the tip of the iceberg with understanding what stress does to the body. I think we know that things like meditation, which has been around for 6,000 years or so, probably it lived 6,000 years because it was useful.
Right.
Or otherwise it would
It's time tested.
it would have
That's
gone
a good
away.
point.
And so, I like to think about the autonomic nervous system in a very simple way. And in this Western world we live in, if you think about the sympathetic nervous system, it's like the accelerator on your car. If you think about the parasympathetic nervous system, it's like the brake. Okay.
Right.
So meditation is putting the brake on. Okay. And you've got to balance that parasympathetic nervous system, because that's what dilates your coronary arteries and allows the blood flow to get down into the muscle itself, into the meat. Otherwise, if you're just running epinephrine, you're just running from the tiger.
Right.
And so that is going to put your coronary arteries in a constricted mode for short term. You don't want that, because that's cracking them like a whip.
So you hear that? If you're always under stress, emotional stress, and you're not putting the brakes on, heart muscle. And so, in closing, I want to say this. So Chad is a business owner. Larry was a business owner. How long did you own your clinic?
27 years.
So he owned a clinic for 27 years, had all the stress of owning a business, plus, just saving lives doing heart surgery. That's no big deal. But Larry now does yoga how many days a week?
Try to do it 5. Sometimes I do it every day. And, having a type A personality, sometimes I do it 3 times a day.
None of you are type A, right? You would be watching this if you weren't type A. But so he finds some stress relief through that. Chad has got it through meditation. And you're going to find through this program that I'm going to give you guys different options for meditation through an app. And that's how we start that. We're going to also offer yoga too. But that's a little bit of a tangent of this video. But stress, even though we can't necessarily measure it, we know that it's a huge negative in your life. Because if you're stressed out, you can't sleep. If you're stressed out, you're not going to work out hard. All those negative factors happen with stress. So we're definitely going to do a lot with stress in this program. And so I want to thank Chad. I want to thank Dr. Larry. And closing this way, guys, be abnormal, man. Know your numbers. Don't be too proud that you can't go see your doctor and ask for help, right? Because you need it. We need to know those numbers. So peace out. Love you. Be abnormal. Thanks, guys.